Okay, regional anesthesia is really easy. All you need is to learn some anatomy. You also need to learn the hundreds of blocks that are in the journals. And then you need to learn to use ultrasound to put blocks, to put needles in places that you never even knew existed. And then you are an expert in regional anesthesia. You have nothing more to learn. You've made it. You have made it. Well, unfortunately, that's not quite the case, because there's so much more to regional anesthesia than putting in a block and walking away. And I think we need to use a holistic approach. And there are three main other holistic factors that we need to look at. Because just like the Tour de France wasn't about the bike, and I think we all clearly now know it wasn't. It really wasn't about the bike. Just like that, regional anesthesia is not just about the block. There's so much more, and there are three main areas. The three main areas are outcomes, value, and education. So when we think about outcomes, we need to move away from just placing a block as it's fun or it makes us feel clever. We should ask ourselves, what is the point? What is the point in regional anesthesia? What exactly are we trying to achieve? And what outcomes are we hoping to achieve for our patients? And a lot of the positive outcomes are related to patient experience. And we may all think that we put in a block and we take away all our patients' pain and our patients think we're amazing. And that might well be true. However, it's important to remember that there are other factors that can influence patient experience as well. So if you are not communicating with your patient, if you appear as if you haven't a clue what you're doing, if you puncture the skin 5 times along with skewering the nerve and pressing really hard with the transducer, your patient may not like it. And the other important thing is to remember that patient satisfaction is inextricably linked to patient expectations. So if your patient arrives in theatre and they're expecting to have a GA, and at the last minute you say, well, actually, Mr. Jones, you are going to stay awake for your operation, they will not like that because it is not in line with their expectations. We know that there are complications with regional anesthesia, and it's important to remember that patients do not need to have a block. So it is important then that patients can weigh up the risks and benefits of having a block. So it's really important to know when not to put in a block, because regional anesthesia is not about you, it's about the patient. Now, value is essentially achieving the best outcomes with the optimum use of resources. The problem is that in a lot of units, blocks are seen as a waste of time and a waste of resources. And there is a lot of resistance to the use of regional anesthesia. And this is the sort of thing that you cannot change overnight. However, if you want to promote a positive culture in your hospital for regional anesthesia, it needs to be seen as a positive thing on the floor, on the hospital floor, but perhaps even more importantly, at boardroom level. And the way to achieve this is to show value. So how can we show value? Well, it's easy. You pick the low-hanging fruit. You choose a pathway where you can easily show how blocks can contribute to value in your unit. And if you choose and create a new pathway, it is blatantly obvious for everyone to see that you can use regional anesthesia to add value to the pathway. Now, remember, if you are trying to create a regional anesthesia pathway, remember that there are a lot of people already involved in that pathway. So you must communicate and talk to these people, and you have to try and explain how the use of regional anesthesia can improve outcomes, but also, are there any parts of the pathway that are now not required due to the use of regional anesthesia? Remember, managing the wear off of a nerve block is your job. You need to educate the patients, you need to educate the surgeons, you need to create a plan for their analgesia when the block is regressing, and you also need to communicate a point of contact if they are having trouble or need further information. You also, if you are creating a regional anesthesia service, you need to have objective information about the patient outcomes. So it is important to important to follow up your patients, and there are quite a few methods that we can use for this. It's also important to choose the right block for the right patient. So there are a few factors that can influence which block you choose for which patient or which procedure. And you can see them here. So first of all, it's important to weigh up risk benefit of every block. So if you have blocks which have similar outcomes, however, the first block has high risk of complications, well then obviously you would choose the block that has a lower risk of causing harm. If you have two blocks which have a similar outcome, however, the first block allows the patients to be discharged from hospital on the same day, well then you would choose that block because it is increasing the overall value of your perioperative pathway. If you have blocks with the same outcome, but there is the first block, that you can perform with the patient supine. The other block you have to roll the patient on their side. We'll choose the most ergonomic block. If you're trying to create a culture of regional anesthesia in your hospital, choose a small number of blocks which are versatile, which everyone in your hospital can learn. Then you can create a culture where everyone in your hospital is comfortable performing these blocks. And if you have a block with excellent outcomes, however, it causes significant motor weakness, so it reduces post-operative mobilization. Well, then it is not slotting into your existing clinical pathway. And finally, remember, this is really important, because as you increase complexity of any procedure, compliance reduces. So if you are trying to create a culture within your department, a positive culture for regional anesthesia, you need to try and promote blocks that your colleagues are comfortable performing, even if they're not experts in regional anesthesia. And finally, education. You can't miss out education, because education is a key non-technical factor in regional anesthesia. If you're trying to create a culture of promoting blocks, you need to be promoting education. And this is really important, because in the past, regional anesthesia has been viewed as a members-only club. Regional anesthesia is not a members-only club. And the days of only a few people in a department performing blocks and nobody else are over. We have to make regional anesthesia a core skill. And you may have heard of our paper where we've promoted the use of Plan A blocks, and the concept is a few blocks for the many. So we chose a small number of versatile blocks which can cover a wide range of operative procedures, and we feel that they should be promoted as a core anesthetic skill. And this is now reflected in the new RCOA curriculum, where our anesthetic trainees have to perform a wider range of blocks. However, we have to think practically about how we can implement it, so it's important that we have a lead clinician for regional anesthesia in every hospital who can drive this process forward. And the other thing that we need to promote learning the hand-eye coordination outside the operative environment. So the use of artificial intelligence and simulation, I think, is key to having a significant impact on education in regional anesthesia. So in summary, regional anesthesia is not just about the block. We need to think about these three main factors: outcomes, value, and education. And if we think about these factors, it will help us to improve patient access to regional anesthesia.